Hi, my name is Jennifer Livschitz, and this is my poster on long-term health-related quality of life following parathyroidectomy for primary hyperparathyroidism, a systematic review. To start with some background, primary hyperparathyroidism is one of the most common hormonal disorders. It's commonly associated with decreased health-related quality of life due to nonspecific neurocognitive symptoms such as depression, anxiety, difficulty with memory and concentration, and sleep disruption. Definitive treatment is curative parathyroidectomy, which has been shown to improve these symptoms and may improve health-related quality of life. Unfortunately, health-related quality of life is not currently assessed on a routine basis in this patient population. As a result, health-related quality of life improvement may be overlooked as an indication for parathyroidectomy by referring physicians. The primary aim of this study is to perform a systematic review to better understand how parathyroidectomy affects long-term health-related quality of life in patients with primary hyperparathyroidism. The significance of this is we believe this data can be utilized to support the creation and implementation of standardized guidelines which assess health-related quality of life on a routine basis in this patient population. We conducted a systematic English language literature review to assess long-term effect of parathyroidectomy on health-related quality of life in patients with primary hyperparathyroidism. The key inclusion criteria is that studies must be written in English, and they must evaluate the effect of parathyroidectomy on health-related quality of life in patients with primary hyperparathyroidism. We excluded studies with a study design of less than 1 year post-operative follow-up to really focus on the long-term outcomes. We also excluded studies with outcomes that did not assess health-related quality of life after parathyroidectomy, and we excluded studies with populations of secondary or tertiary hyperparathyroidism. Moving on to the results section, you can see in Figure 1 that we started with 3,008 studies, and by the end we were able to narrow it down to 31 studies that were included in this review. Out of 31 studies, 27 or 87.1% of the articles demonstrated improvement in preoperative symptoms and sustained increase in long-term health-related quality of life following surgery with parathyroidectomy. The remaining 4 studies, or 12.9% of the studies, showed mixed results for changes in health-related quality of life, some favoring surgery and others favoring observation. If you take a look at Table 1, you can see a breakdown of all of the various quality of life tools that were utilized by included studies. I want to draw your attention to SF36, or short form 36, and PAS, or parathyroidectomy assessment of symptoms, as these were the 2 most popular surveys utilized by the included studies. As a result, you can take a look at Table 2 and Table 3, where we actually break down the change in quality of life pre and post parathyroidectomy based on PAS and SF36. The purpose of doing this is we wanted to aggregate the data from all of these various studies to take a look at which of these features actually improved more often or less often. These 2 tables combined essentially show us that patients are most likely to see improvements in mental health, fatigue and weakness, mood swings and memory, and they're least likely to see improvements in general health, physical function, and pain in joints, bones, and abdomens. We hope this information can be used to create realistic expectations between patients and providers of what is likely to improve and potentially not improve after surgery with parathyroidectomy. This study is innovative because previous systematic reviews have been small-scale studies with narrow inclusion criteria. This is the first systematic review to look at long-term health-related quality of life and include 30-plus studies. We have 2 big strengths of this study. One is through our systematic process, we're able to reduce bias and increase transparency. Additionally, this brings together 23 years of research conducted in 14 different countries. We have 3 key limitations to this study. As you can see, there are a variety of different quality of life tools that were utilized by these studies. Each study utilized a different follow-up schedule, which made them difficult to compare, and there was a lot of heterogeneity between study statistics. In conclusion, parathyroidectomy provides improved and sustained health-related quality of life in patients with primary hyperparathyroidism. Patients with primary hyperparathyroidism should be screened with a validated health-related quality of life tool at time of diagnosis to help guide discussion regarding these symptoms in a preoperative setting and the potential for long-term improvement. Future work should include standardized evaluation and treatment guidelines for patients with primary hyperparathyroidism to include screening with a validated health-related quality of life tool, and to compare various health-related quality of life assessment tools and determine which one should serve as the global standard for primary hyperparathyroidism health-related quality of life assessment. I would like to thank Dr. Dream, Dr. Wang, and Dr. Yen for their help. Thank you very much.